Rise and shine. Rise and shine. The secret ingredient for a rocking morning blaze.
The greatest hits.
All wrapped up and ready to go. This is the Morning Mojo
On Radio 44.
Good morning, it's Hermina on the Morning Mojo on Radio 44. And in this hour, we're going to be talking medical tourism with Mr. Iftakhar Asfi from Fakeeh University Hospital in Dubai. You can learn about how they're transforming healthcare and how you can avail their services. It's going to be an interesting chat, so stay tuned for that. Good morning, welcome to the Morning Mojo. Sabrina Carpenter with Espresso playing for you on Radio 44, and in the studio with me is a special guest this Friday morning. First of all, let me tell you about Fakeeh University Hospital. It's part of the Dr. Suleiman Fakeeh Group, headquartered in Saudi Arabia, having a presence for over 5 decades, and it's part of Fakeeh Health UAE and one of the most pioneer and high-end healthcare providers in Dubai. I am joined in the studio now by their Chief Commercial Officer, Mr. Iftakhar Asfi. Welcome to Radio 44. Morning. So we'll get straight into the conversation, and I'll start by asking you, first of all, please tell me more about the group.
Good morning, Nairobi, and it's very pleasure for me to be here this morning. Lovely weather, lovely people. Lovely breakfast. Is
this your first time in Kenya?
No, I've been to Kenya many times in the past, and recently I was just 6 months ago.
Okay.
Love the country. So, again, Fakeeh University Hospital, as you said, is a part of Dr. Suleiman Fakeeh Group based in Saudi Arabia. We are a pioneer healthcare provider, and we are one of the oldest private healthcare provider in the region, in the MENA region. And when you talk about healthcare, if you go any first, like any renal transplant, liver transplant, or any high-end tertiary care services, it was done at Dr. Suleiman Fakeeh Hospital, Saudi Arabia, in Jeddah. Fakeeh University Hospital is the first hospital for the group outside the Kingdom of Saudi Arabia, and we started almost 4 years back in Dubai. And now we are one of the most pioneer high-end tertiary care hospital. We can say we are one of the largest hospital with 350 bed capacity. Having its presence in Dubai, we are having the largest ICU, largest NICU, and ultra luxury premier care institute based in Dubai.
Okay, and what are some of the services that your hospital provides?
Okay, we are one-stop shop for all healthcare services, all healthcare requirement. We do from a child at a birth stage till, any age you can talk about. You can talk about any services, like from a pediatric service to a neurosurgery to cardiac surgery and so on. We are very much, you can say, advanced in all surgical areas, including cancer, including neurosurgery, orthopedics, sports, even cardiac surgery. That is, we are one of the very few hospitals that is providing. There are many other services that we do, like that is, we are having the competitive advantage. Like, we are the only private hospital doing trauma, because getting trauma in Dubai is limited to the government hospital only. So recently we got the trauma certified hospital that catering to the community in Dubai. We have got hyperbaric oxygen, that is, again, very few hospitals doing. Then we got gene therapy, that's a rare disease treatment, the only hospital we are doing right now. There are 1 or 2 hospitals, but we are again the pioneer and the lead one here. Then you talk about the areas in cancer. We are very advanced, but our philosophy is ethical practice, giving ultra luxury care, patient experience, And most importantly, we are a digital hospital. We are a smart hospital.
Okay, we will discuss more about the digital hospital because it sounds very interesting and I'm sure everyone wants to know more about it. But where does Fakeeh University Hospital have its presence? Which other countries?
As I said to you, like we are almost completing our 47th year. This year, and will be 48th year starting by end of this year. So we started our first flagship hospital in Jeddah as Dr. Sulaiman Fakeeh Hospital. And since then, we keep expanding in Jeddah itself. We've got our mother company and one of the largest hospital in Jeddah, where we are catering around more than 100,000 patients per month. And we have got, you can say our satellite clinics in different parts. We've got executive clinics. And on top of that, we are in academics as well. We have got medical college, we've got nursing college. So our philosophy is both, training, education, and healthcare provision.
Okay.
And then if you go take it further, we started our first hospital outside Kingdom is in Dubai. And then lately we started our first hospital outside Jeddah in Saudi Arabia is in Riyadh. And then we are coming up in Mecca, in Medina by end of this year.
Okay, we shall be discussing more, especially about why you're referred to as a digital hospital. I'm in conversation with Mr. Iftakhar Asfi, the Chief Commercial Officer at the Fakeeh University Hospital based in Dubai. Stay tuned, we have a lot more to discuss. Jasmine Sandless and Sachin Jigar playing for you on Radio 44. Hope you're doing well this morning. Hermina with you on the Morning Mojo, and we're in conversation at the moment with Mr. Iftakhar Asfi who's the Chief Commercial Officer at Fakeeh University Hospital based in Dubai. So let's get back into the conversation. We left it as you saying that your university hospital is a digital hospital. What exactly does that mean?
This is the era of AI, digital presence, then electronic-driven society. So when we talk about a digital hospital, we are first of its kind. We always call it raising the bar. When you talk about as a patient journey, you talk, since the patient enters the hospital and until they leave the hospital with their treatment, they see so many things first time in their life. For example, medical records, as electronic medical records is very common. It's available everywhere. But when we see about medicine dispensations where mostly errors happen, we have got completely robotic pharmacy, where the medicines are dispensed. Medicines are, unit dose level. They are always configured and delivered by the robots, so that there's no margin of error. When you talk about inpatient facilities where we have to give medicines, the dose is up to the level. It is done through pneumatic system, like a tube system that goes to the patient room. When you talk about laboratory, again, the blood samples are from the patient room to the laboratory. It goes without any human intervention. It goes through through digital pipes and through it goes directly from the phlebotomy area to the patient room up to the laboratory through a digital way. When you talk about medicine delivery, we are doing drone delivery of medicine through drones, and then we've got robotic bots. Same like you say today's time when you go Talabat or Swiggy or Zomato, the way deliver food, we deliver medicines through robots to the patient's home. Apart from that, if you go through our patient rooms are made in a way like the EMR system is alive in front of the patient. We are integrated with Apple. So as a patient, when they are in the patient room on their bed, they have the iPad. They can have access to their medical records, to their nursing records, to their food habits, their food requirements. And the environment inside room whole is managed through the patient at their fingertip through the iPad. And apart from that, if you see our admin areas, we do robotic process automation, like many of the jobs to be done by the staff physically is nowadays being done by robots. Apart from that, if you go on the treatment side, our OT is very OR setup is AI driven. Like artificial intelligence we use for the precision of the surgeries. Like we're using robots for surgeries.
Wow.
We're using robots for knee replacement, say, for minimum blood loss, for saving the timing of any surgeries. At the same time, if you go to our radiology, again, this AI driven, like we have got Vida MRI that saves your time by 30-40%, and then again, the findings, the reportings, all are very much automated and done mostly through robots and through artificial intelligence.
And why is it called a university hospital?
Good question. Thank you for asking that. When we say about Fakeeh as a group, since our inception, as I told you, we focus equally on physical side of treatment and at the same time academics. So as I said in the beginning, that we also have a medical college in Saudi Arabia in our parent company, in Dr. Sulaiman Fakeeh Hospital. So we have nursing college, we have pharmacy college. Same thing we are doing in Dubai. Like we are coming up with our medical college 2 years down the line. And currently, if you see, we have got many programs, including residency program, like fellowship program we are doing now. And pharmacy, there are many programs we do for facilitation and for advancements of education for the students. So when you go to our hospital, you'll find it like students are there, hundreds of students you'll find in the lobbies, in different areas in medical areas. We train the students, we advance the students. They at the same time, many of our doctors are doing proctorship, and many companies are associated with us that goes in the field of education. We've got a separate department called ATA, who's managing the whole scope of training and education. We do different kind of education that is required for nursing, for pharmacists, for allied health, for doctors, to advance their knowledge, to prepare them the future best doctors. So, and then we do live surgeries. There are many things. If you see, Fakeeh is a different game ball in total.
Okay. Yeah. Earlier on, you had mentioned hyperbaric oxygen therapy. What exactly is that?
Okay. Again, very few people are aware about it. Hyperbaric is one of the services that are rarely available in hospitals in general, in Dubai or in UAE or in different parts of the world. For many medical experts, then these terms and these services are not that popular. When you talk about hyperbaric, like this is a kind of non-invasive treatment, and many of the treatments are done with the help of oxygen. This is a kind of like a chamber of what we have at Fakeeh is a 10 chaired chamber where the patient with different kind of medical ailment as recommended by doctors, they go inside the chambers, and under that environment with say high oxygen supply, say up to 99%, many things are being treated that usually or traditionally used to be either surgically or in different ways. So this is non-invasive, and it treats many health issues like hearing issues, chronic ulcers, cancers, neuro rehab, migraines, and many times like respiratory disorders. All such things are being treated under an environment, or a physical environment, not being non-invasive way. Like for example, diabetes food that I have seen from my eyes. Like many doctors, they went all sort of treatment, but it was not treatment. They had been advised to go for amputation, but it was a miracle when we went through hyperbaric chamber treatment under the supervision of the experts, and they were very well now. Many kids, many adults, they have hearing issues, and with this treatment, they're done very well. They're back in normal life.
Okay.
So yeah, this is a very much upcoming, modern, you can say, modern time
technology and treatments available.
Yeah.
Okay, we shall discuss a little more about especially how somebody listening, a Kenyan, can access your services. I'm in conversation with Mr. Iftakhar Asfi, the Chief Commercial Officer at Fakeeh University Hospital based in Dubai. Stay tuned, we have a lot more to discuss. playing for you at 16 minutes to 9 this Friday morning, the 21st of February. You're with Hermina on the Morning Mojo, only on Radio 44. And I'm joined in the studios today with Mr. Iftakhar Asfi from Fakeeh University Hospital in Dubai. We're talking about medical tourism and also their game-changing innovations. So, Mr. Iftakhar, let's go back into the conversation and tell me what gene therapy is. I saw on your website you offer these services. I've heard of it, but I'm not very sure exactly what it is. So what is gene therapy?
Gene therapy is like, again, it's good you touched this point. Like, we are, first of all, I'll tell you, like, this is a rare disease management, and this is available in very few countries across the globe. Like, one is United States, and then Germany, and now it's UAE. UAE is the leading one providing this is a rare disease management program where like the babies like up to the age of like until they become adolescents, like these are like they have got their lifespan defined. Like if they don't get treated, then they do not survive for longer periods, say beyond 5 years or 6 years. So this is like a very, you could say, rarely available treatment, though it's very expensive. But many of the countries, like, they cannot afford such kind of treatments because of the limited availability of the experts, of the medicines. There's no access to such treatments, and unfortunately those children, they don't survive for long. Fortunately, we at Fakeeh University Hospital were able to introduce this scope of service, and we have been treating kids from different parts of the world, from like developed countries, like who cannot afford to go to United States or Germany. An easy destination for various reasons is UAE. So in Dubai we have started this service, and we have got excellent results.
But what exactly does it entail? How do they do it?
Yeah, this is mostly a therapy based. Like the medicines are limited to only 1 or 2 companies, and this is like mostly a genetic based medicines, and this is kind of therapy. Like when the baby comes, they are first evaluated. And after that, because such babies are diagnosed with this disease by the doctors in their home countries or by their family doctors, and there are no further treatments available for this. This treatment is very expensive, and mostly people either go through crowdfunding or many of them who are able to pay, they do it. This is the region, like, this is not accessible to everyone in general. The treatment is in millions of dollars. The people do pay, and then the experts are very few available, well trained. Unfortunately, we at Fakeeh University Hospital, we are providing this service.
Okay, now your website mentions affordable patient-centered healthcare solutions. So how does Fakeeh University Hospital work to make its services accessible and, more importantly, affordable to a diverse patient population?
Again, nowadays healthcare is very competitive. If you see all countries across the globe, they are coming up, they are making huge investment in their healthcare facilities to provide to the community. At Fakeeh, when you go, I would like to invite you to come and see what we are. We are different. See, every hospital, they do provide basic healthcare facilities, tertiary care level healthcare services, and same we do. But how we are different? We are focusing on like, say, patient experience. That is very exceptional. That is like a differentiator for us. We care our patients, our family members. So the journey, when you start, suppose that when you travel from Nairobi to Dubai, from the moment you start the inquiry, the moment you arrange your logistics, the moment you land to Dubai, and then how you enter the hospital, then you do your pre-operations, post-op, your journey across from the point of your registration until the surgery is done, and then your discharge, and how you are taken care of after surgery. All these things are very exemplary. We are investing in this. And this is the region, if you go through our testimonials, you'll find it there. How we are affordable, another part. See, all such things have cost. And when we see healthcare is getting expensive every day. So we have done our pricing in a way that is accessible to everyone. Whether if you talk about Dubai, we try to cater to all sector of the community. We cover variations in our insurances so that most of the people have access to us. We do like kind of packaging in a way. We provide discounts to the patients so that those even who is willing to come to Fakeeh University Hospital for certain treatments and they cannot afford, we do special packages for them. Apart from that, we have made community clinics in different parts of Dubai where their different sector of insurances are covered. There are many people cannot travel to Dubai Silicon Oasis, where is our hospital. They can go to our different community clinics, satellite clinics. So you can say our accessibility, we are trying to make sure, like, I mean, if you go 1 year back, we are only one hospital. Today, we are one hospital, and then we are 6 satellite clinics in different geographies in Dubai.
Okay.
Yeah.
And you are in Kenya for a few days. Tell us why you're here.
Okay. See, I mean, there are 2 reasons for this. One, you can say we want to make visibility for Fakeeh University Hospital, Fakeeh Care Group in Kenya. Second is like we want to extend our services to the community in Kenya, to the people of Kenya, where they need advanced healthcare services, premier healthcare services, and the services that cannot be managed in Kenya. See, Kenya is doing very well. Kenya healthcare system is advancing well. But again, there are certain areas that is still an area
lagging behind.
Lagging behind. So those who cannot be managed here, they could be treated at a very affordable price, in a very personalized care way. In Fakeeh University Hospital, Fakeeh Care Group in Saudi Arabia, Fakeeh University Hospital in Dubai, they can come and we can provide a home kind of environment, very customized, personalized care we can provide to them. That's one part. Secondly, we have got our presence here recently, but medical tourism is a kind of thing. It's not only in Kenya. Like our objective to go to all those areas, all those countries where healthcare is still advancing. Like if you go to East Africa, in different countries here, you go to West Africa, you go to Nigeria, you go to even Somalia to the level. We want to go to the community. This is our passion, to take healthcare services to the doorstep of everyone.
Okay.
Yeah.
So you have partnered with Parishay Healthcare Africa. Tell us more about this partnership.
Yeah. So when we came here, like we are again strangers to the country, and when we go for choosing our partner, we are very selective. As I said, we are a very ethical group. Our motto of our growth is our ethics. We go very scientific, so we cannot go with anyone and everyone. After a lot of recommendations, a lot of research, and a lot of looking after various factors, we found Parishay Healthcare. I mean, our trusted partner, and they are going to represent us in Kenya. And they have got a history of managing huge volume of patients. They're transferring to different parts of the world. I mean, they have got credentials. They have got good reputation of managing patients' needs from medical and non-medical aspect from both sides. And at the same time, they have got very established presence in Kenya. They're currently located in KMA Center. There's a hub for healthcare services in Nairobi, and they're located in Upper Hill. And they have team of professionals, who take care of your needs. They take care. They're like the family. They address to all your needs, being from an inquiry level to manage your insurance, to manage your logistics, to manage visas, say whatever, so on. So they do provide, and they have got a reputation that's important for us. So Parishay Healthcare, we count on them, we trust them, and we are building up a program that is very sustainable. We have long plans to go with them. We have long plans to expand Fakeeh Healthcare presence, Fakeeh Health. Our visibility in Nairobi and different parts of Kenya are going to be very prominent very soon.
Okay, so once again, the contacts for Parishay Healthcare Africa, they're at KMA Center in Upper Hill, and their phone number is 0741 51 993. And if anybody's interested, you can email them at fuhkenya@Fakeeh, which is FAKEEH.care. Any last thoughts before we wind up?
Yeah, I mean, I want to give again a message to the community here, to the people here, to the beautiful country. Like, we are here to support the healthcare system. We are not here as a competitor. Rather, we are going to complement the healthcare system. We are going to assist the community. We are going to help. We are going to assist the industry the way the people require here. And at the same time, I mean, we are always available for right practices, for ethical practices, and we are a destination for certain healthcare requirement that is not available here. So more details could be seen in our website called fuh.com, www.fuh.com, where you can see about us, you can read about us, you can see the testimonials, what we provide, how we provide. So again, I love the country. We want to be the part of healthcare fraternity in Kenya, and we want to serve the community. We want to be at the doorstep, and in future, if all goes well, we can have a bigger presence here to support the people of Kenya, people of Nairobi.
Thank you so much for joining us on the Morning Mojo on Radio 44 this morning. It was truly enlightening to hear about the innovative work that Fakeeh University Hospital is doing in medical tourism, and just how you're a digital hospital. It's enlightening to know about that, and your partnership with Parishay Healthcare. I'm sure it's going to benefit a lot of Kenyans. So once again, thank you for sharing your time with us, and those details, Parishay Healthcare Africa, KMA Center, Upper Hill. You can call them 0741 4151 993. So it's once again 0741 51 993, or you can even email them at fuhkenya@fakeeh.care. Once again, thank you so much for spending your morning with us at Radio 44. We appreciate it.